If your patient suddenly cannot breathe and is clutching their chest, you have minutes to act. So we're talking about a pulmonary embolism. This is a medical emergency where a thrombus or other matter obstructs the pulmonary artery, blocking blood flow to the lungs. So if you miss the signs, it's game over. Okay, so go ahead and grab your textbooks and meet me right back here. But y'all, before we start, hit that save button. Pulmonary embolism is a critical priority for your med-surg exams and your critical safety. Drop a in the comments if you've already started learning about venous thromboembolism in your clinical rotation. Step 1 is the patho breakdown. Okay. A pulmonary embolism, or PE as it's known, occurs when a substance, most commonly a blood clot or a thrombus, enters the venous circulation and settles in the pulmonary artery. This obstructs blood flow to the lungs, which causes a sudden increase in pulmonary vascular resistance. This leads to impaired gas exchange and can quickly cause right-sided heart failure and decreased cardiac output. It's a life-threatening cardiovascular and respiratory event. Step 2, risk factors. You have to know what causes these clots. The most common cause is a deep vein thrombosis. Okay, this usually starts in the legs, but pulmonary embolism can also be caused by air, fat emboli, from fractured long bones, amniotic fluid, or even septic debris. Okay, patients at the highest risks are those with prolonged immobility, post-operative patients as well, or anyone with a history of heart failure, obesity, or advanced age. So if your patient is stationary, they're at risk. Step 3 is manifestations. All right, so the number one sign is dyspnea, sudden, unexplained difficulty breathing, right? So watch for sharp pleuritic chest pain and a rapid heart rate or tachycardia. Your patient will likely have a cough, and in most severe cases, they might cough up blood, which is hemoptysis. You'll see tachypnea, which is rapid breathing, and a drop in oxygen saturation. If they're feeling an impending sense of doom or showing signs of shock like hypertension and cyanosis, you're looking at a massive embolism. Okay? Step 4 is diagnostics. How do we find it? The gold standard is the pulmonary angiography. So we also use a ventilation perfusion scan, which looks at airflow and blood flow to see where the air is going, but the blood isn't. Okay? If you understand what I'm saying. In the labs, we check for D-dimer. If it's elevated, it means there's a clot breakdown happening in the body. Okay? We also use chest x-rays, electrocardiograms, and arterial blood gases to assess the severity of the respiratory failure. Step 5, nursing priorities and nursing interventions. Guys, remember, this is a medical emergency. Okay? Your first priority is to stabilize the patient. You want to give supplemental oxygen immediately. All right, you'll be managing anticoagulant therapy, starting with heparin to prevent the clot from getting bigger, and then transitioning to oral warfarin, also known as Coumadin. For a massive pulmonary embolism, thrombolytic therapy like tissue, plasminogen activator, that's what TPA, may be used to dissolve the clot. If the patient cannot have meds, they may need an inferior vena cava filter or an embolectomy. Okay, keep the patient on bed rest and monitor their vital signs constantly. Step 6 is education, teaching, and evaluation. All right, so what does success look like? Success looks like the patient respiratory rate and heart rate returning to baseline. Their oxygen saturation should stay above 92% on room air or minimal support. For education, you want to teach them about venous thromboembolism, right? Prevention. Venous thromboembolism prevention. Do not cross your legs, right? Avoid prolonged sitting and wear anti-embolism stockings. If they're on warfarin, they must have regular lab checks for their international normalized ratio, that's the INR, and know the signs of bleeding. Yeah, so that's it for this video. It was really quick, very simple, very easy. If you follow these 6-step frameworks that I'm dropping on y'all constantly, you should be good because I'm breaking everything down, okay? And listen, I'm always leave y'all with this. Never dim your light for anyone. Stay lit.